started coming to the Spine Center because I was having a lot of back problems. The first one kept me in bed 8 days. I thought I'm fine. Happened again a couple weeks later. I was in bed for 4 to 5 days and decided I can't go on this way. I've got to figure out what's going on.
Here we really offer, the full spectrum of services from, evaluating and treating their pain, advanced diagnostics, whether it be x-rays or MRIs, on-site physical therapy, nerve testing, injections if they need that. So really we offer the full services here in the Spine Center. It's really trying to streamline their care and make it as efficient and as possible for them and get the best outcome possible.
Some of the times back and neck pain will present not necessarily as back and neck pain per se. Patients may have heard of the phrase sciatica, for example. The sciatic nerve is the biggest nerve in the body, and it comes from the spine and then goes down to the legs. So sometimes patients are coming in with leg pain or arm pain or numbness or tingling in their hands, feet, legs. And so we look at the source of that, which is often the spine. Most patients have a pretty good sense when something is really wrong. If the pain is very severe and is not going away, and you're concerned that there may be something else, then often seeing either a primary care physician or a spine specialist is appropriate.
I really think there are a couple instances where someone should really seek specialized care for their spinal pain. One is if someone by chance has, say, a first episode of neck or back pain that doesn't get better over the course of, say, about 6 weeks or so. Another instance would be someone who has dealt repeatedly with multiple episodes of pain. So maybe every couple of months or so they have a debilitating episode of low back pain or neck pain, and then it will get better, but then the pain recurs. The
other thing we look at is generally pain gets a little bit worse with activities and better with rest. So if you find that at bedtime you're having severe pain, it's not getting better or worse no matter what you do, that's a little bit of a worrisome sign. The physicians in this community spine center are physical medicine and rehab doctors. And so our training is really looking at function, and that works well with the patient because when the patients come to us, oftentimes it's because they have pain, but it's also because they're not functioning normally, and they want to be able to play with their child when they get home from work or do gardening on the weekend. And so what we're really focusing on is what is it that they want to do that they're not doing, and try to get them back to that level of function.
We try to really keep the patient, really involved in the process and really lay out, to them, what all their treatment options are, and then take into account what their personal preferences may be.
Fear was really the biggest concern I had when I came in. When is this going to hurt again? Will I be able to pick up my toddler again? And from the get-go, everyone was, we have something that will help you. We will figure it out together.
We really try to get all the background information possible so we can review that ahead of time. So any studies, such as x-rays or MRIs or testing or even treatments, anything that's been done previous, that we can, review all that ahead of time. I think it helps make our patient care better and more efficient.
Sometimes we use medicines to try to reduce inflammation or pain to help people function despite the pain while the body heals. Sometimes we work with physical therapy programs to help flexibility and strength. Occasionally surgery is needed, but most of the patients that have back and neck pain really don't need surgery.
Physical therapy provides assistance with diagnosis, but more importantly and more usually, we're helping to educate the patient on how they can manage their back pain and how they can start relieving their symptoms themselves when they're at home. The therapist that you're going to see only treats spine patients, and our training's been very focused as such. And the fact that we work closely with the physiatrist and with the patient as a group, I think is invaluable.
After I went through a whole series of different stretches, we found the trigger. And so once we found that trigger, that's when we started to figure out, okay, this is the plan that we need to follow. Physical therapy for me was wonderful. It finally gave me the courage to do the things I hadn't been able to do before.
typically will see people in about half the number of visits and get the same or better functional outcome scores.
We try to get them better in as few visits as possible and give them the tools to help manage their condition.
I finally feel like, as trite as it may sound, I feel like I finally have my life back. I'm back to normal. I can do the things I wanted to do, and I don't constantly think about when is it going to hurt, when is this going to happen to me again. I'm just back to me.